In this video, we will show you in detail how to topicalize the oropharyngeal mucosa using the SFERE technique.
Welcome to the oral section of the awake fiber optic intubation technique. The equipment you need for this is the mucosal airway device and 3 to 4 syringes of 2% lignocaine. The total dose you actually need of local anesthetic is depending on a patient's weight and a maximum toxic dose of 9 milligrams per kilogram for lignocaine. At the start of this procedure, you ask the patient to open the mouth as wide as possible so you can try and visualize the structures, which is the base of the tongue, the uvula, the fauces. Emma, do you mind opening wide? Stick your tongue as far as possible. Good, thank you. So you take your first syringe and you inject the 5 mils and try and coat all the structures as liberally as possible. So open it wide. And spraying from side to side. Allowing her to gargle and swallow. I'll do it one more time to finish the 5 mils. You now take the second syringe and attach it to the mucosal airway device, and you want to test how well your local anesthetic is working. So the 4 areas that you test are the uvula, the back of the tongue, and the posterior oropharyngeal wall on either side of the uvula. So Emma, do you mind opening your mouth for me? Stick your tongue out, touching base of the tongue. Say ah, touching our uvula and a posterior pharyngeal wall on either side. Thank you. It seems to be working really well, but just in case there's an area or particular area that doesn't seem to be adequately anesthetized, you can spray 1 or 2 more mils and cover that area and repeat the test. At this stage, because it's working well, I'd bend the tip of the mucosal airway device about 2 centimeters from the tip, and a good guide is the length of your thumbnail. So you bend it to 90 degrees, and the idea is that you're going to insert it into your mouth and swivel it. So you start by injecting 1 mil at one end, 3 mils in the center, and another 2 mils at the other end. So Emma, do you want to open up wide? Just putting it in the center. Injecting 1 mil, 3 mils in the center, remaining 1 mil right at the end. Good. Do you gargle and swallow? Excellent. Now that you've sprayed, you want to test those 4 areas again, and also the back of the base of the tongue and its corresponding posterior oropharyngeal wall. So you get the patient to open up wide. Stick your tongue out as far as you can. Say ah. So I'm touching the uvula, posterior pharyngeal on either side, and the base of tongue. You come out again, bend it again at 90 degrees, and go back in. Say ah. And now go right to the bottom edge, touching the base of the tongue on either side and the back of her posterior pharyngeal wall. And you can see she's tolerating it very, very well. And now, at any point, if there is another specific area that you find that's inadequately anesthetized, use the remaining local anesthetic that you have to spray it and cover that area. Wait and retest until you're happy that the patient's oral and nasal cavity is well anesthetized for this procedure.
Be sure to check our other training videos on the SFERE awake fiber optic intubation technique.